The question for you, Christina, and others are welcome also to participate and respond. Christina, how does the current LTSS coverage system in California exacerbate poverty, economic insecurity for older individuals, and people with disabilities?
Yeah, thank you, Kim, and thank you for inviting the California Foundation for Independent Living Centers to be a part of today's discussion. For those of you who don't know, we're a statewide disability rights organization and have been very honored to be a part of the master plan process, as well as a lot of different discussions on long-term services and supports. And it's always interesting to be presenting via Zoom rather than in person, because what you don't know is what you can't see, right? And so I'm a person with a disability. I was born with a disability, and LTSS is something that's personally and professionally very near and dear to my heart because of the cycle of poverty that so many people with disabilities and those who are aging often fall into as a result of being honestly on the cliff of an accident each day of our life. So whether you're like me and are born with a disability, or have nothing and you're completely healthy and been doing great things, and one day you just never know what's going to happen. And the way our system is set up is unfortunately creates a cycle of poverty, whether you're born with a disability or are aging and become disabled, in having to access state and government services to be able to continue to live your life. And so just want to start by sharing a little story about myself. While I was born with a disability, I was also born to a teen parent, a single mother, and born on a military base. And I wasn't diagnosed until about 14 months old. My disability is osteogenesis imperfecta. I break bones easily. And when I was finally diagnosed, I went onto the Medicaid system and got the healthcare services that I needed, thank goodness. But as I continued to age from childhood to youth to adulthood, it became very obvious to me that if I was going to be able to be successful and go to work after college, that I was going to have to take a significant risk in letting go of my government benefits in order to find an employer that could offer me the healthcare benefits and the long-term services and supports that the government was providing for me. I'd have to let all of that go in order to seek employment and get out of poverty. And that's so often what people with disabilities are faced with and are challenged by not wanting to go to seek employment, because it is the cycle of losing Medicaid, which is always the #1 priority for so many of us who frankly require and need care services, personal assistant services, as well as durable medical equipment. All of the things that the government fortunately helps cover for us, we are forced to let that go in order to be able to seek employment and get other types of LTSS. And when we do that, for example, in my own situation, we also let go of maybe not being able to afford in our jobs to pay for those things out of pocket. So needless to say, it's a balancing act, and it's sort of like robbing Peter to pay Paul in terms of, do I want to pay for my wheelchair repaired this week, or do I want to pay for my domestic worker who comes in and assists me once a month in our house? I mean, it's always a balancing act, and you would never expect that from somebody who is an executive director of a statewide organization and still is living paycheck to paycheck, because we don't have an LTSS system set up that is able to provide the level of needs and services so that I can be successful and my peers with disabilities who want to go to work can be successful outside of specific government guidelines that we currently have in place. And just to also add that, you know, I have a grandmother that I'm a care provider for currently. I coordinate all of her care in Marin County. But in addition to that, my daughter was born with significant disabilities. And while we were able to get her on our employment insurance and able to get her on California Children's Services, Medicaid services, it wasn't enough. And unfortunately, she passed away. But out of pocket each year, we were paying about $45,000 annually to cover her LTSS needs. And that was just her needs, not the needs of our entire family that is also made up of people with disabilities. So, you know, when we talk about the value of care, I look at care as a very in a very broad way, and in the biggest way, because care isn't just personal care assistance. It's care on so many different levels when it comes to long-term services and supports. And what we really at CFILC are working towards is creating a system that allows people with disabilities and those who are aging to get out of poverty, not have to live in poverty in order to have their best life. And that's what we're really looking for, a quality of life that values people with disabilities and people who are aging that become disabled.
Thank you so much, Christina. Thank you for all of your organizing.